living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
We use our bladders every day, but how often do we stop to think how healthy our bladder might be? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to learn about bladder health, including how age impacts your bladder, symptoms of an unhealthy bladder, and steps we can take to make sure our bladder stays healthy. Stay with us. We'll be right back after these messages. Welcome back to Healthy Living for Life. Joining us today is Dr. Kevin Brown, who is a urologist with St. Peter's Health. And thanks so much for being with us today, Dr. Brown. We appreciate your time.
No problem. Happy to be here.
So let's start with the age question. What happens to our bladder as we get older?
So as you get older, we tend to see more urinary symptoms in individuals, and the kind of classic complaints that we get are more urgency, frequency, and sometimes even difficulty urinating.
And are the issues different depending on whether the person is a man or woman, or are aging impacts on the bladder the same no matter the gender? Can you talk about that a little bit?
Yeah, a lot of it, the symptoms become somewhat different, but there is a lot of overlap. But generally speaking, men have more of what we call obstructive symptoms, where they have a weakened urinary stream or more hesitancy or straining, whereas women tend to develop more overactive symptoms with urgency, frequency, and incontinence.
Okay. Let's talk about some other impacts that just time or age or other factors might have on our bladder health.
Yeah, and so making sure that you have good bathroom habits and emptying your bladder on a regular basis prevents it from being overdistended and overworked. Also staying well hydrated so that your bladder is properly cycling throughout the day is important too.
What are some of the more common bladder problems, health conditions that you see when people come in?
Yeah, so we tend to see a lot of what we call bladder overactivity, where the sensation and signaling between the brain and the bladder get a little bit discoordinated, and so the bladder decides to start sending the signals and even sometimes squeezing when there isn't a full bladder, and so it results in people having to make a lot of frequent, quick bathroom trips with not a lot of volume, and that can be disruptive and bothersome in just your day-to-day activities. And then we also get people with what we call obstructive urinary symptoms, where the urine force isn't quite there and it's harder to empty out the bladder to completion.
So you mentioned making sure that we're going to the bathroom regularly. Are there tips beyond that we can be doing to try to maintain bladder health that we may already have?
So, in addition to those other things, there are some dietary factors that can affect the bladder. So the general trend is anything that has a lot of caffeine, acid, or spice will be more irritating to the bladder and make your urinary symptoms worse. And so curtailing those different food items can sometimes help minimize the symptoms as well.
What about beverages and things we drink? Does that have an effect on a healthy bladder?
Yeah, I think everybody kind of comes to realize, after you drink a cup of coffee, that in the morning you feel that sense of needing to urinate a little bit more urgently than you do at other times. And that's a combination of the caffeine that's a natural diuretic, so it's going to make your body produce more urine. And then any of the darker beverage like coffees, teas, colas also have a fair amount of acid that can be irritating to the bladder as well.
Okay, so I'm guessing the best thing for our bladder is probably water.
Yeah, water's the best. We always kind of go over what we drink with people who have kidney stones quite a bit, because hydration is an important part of kidney stone management. But for the bladder, it's the same kind of thing. Water's the best. If you can't tolerate just water, then anything that has a little bit of flavor but is clear definitely is less irritating to the bladder than the darker colas, coffees, and teas.
Okay. And how much water or a lighter liquid should we be getting? Is it the same for everybody, or does it depend? Can you talk about just, amount of fluid?
Yeah, so there are some different medical conditions that change the amount of fluid you should be drinking on a daily basis. And so there's a couple of different strategies to kind of manage your hydration status. One is just the color of your urination. So you want your urine to be either a clear or a very light tinted yellow. The more concentrated, like an apple juice color, that tends to be because the urine's more concentrated, and so you need a little bit more fluid. A good general goal is, between 6 to 8 cups of water a day.
Okay, great. And people have probably heard the term a weak bladder. What is that really? What are we talking about there? And what are the symptoms that people would look out for to tell whether they have a weak bladder?
Yeah, a weak bladder often refers to one of two problems. One is that a bladder that just doesn't empty out as well. And when that's happening, you're basically taking your normal bladder capacity and diminishing how much is emptying out. So it reduces your capacity that you're able to store. And so you have a lot more urgency and frequency. The other common thing that we see with people who are complaining of weak bladders is just not being able to generate that urinary force to get a good stream and empty out.
Okay, so then those would be the symptoms there, either urinating more frequently or not really getting a good stream going.
Yep, absolutely.
Okay, so we have about a minute left. Are there just general bladder health tips we want to hit before we have to take a break here?
Yeah, I think it's a lot of the basic stuff that we've gone over. And if you start to notice changes in your urinary symptoms, whether it's increased urgency or frequency or just trouble urinating, a lot of times we tend to put off those conversations because of the nature of, not wanting to talk about sensitive areas. But
Sure.
It's something that the earlier you get evaluated and have intervention, whether it's, dietary or medications or even procedures, the better off the bladder is in the long run.
Okay, that's great. And so we do need to take a quick commercial break here, but when we come back, we are going to continue talking with Dr. Brown, specifically about some of the more common bladder conditions and what the treatment options might be. So stay with us. We'll be right back after these messages. Welcome back. We are still talking with Dr. Kevin Brown, a urologist with St. Peter's Health, and thanks for sticking around to talk to us a little bit more, Dr. Brown.
Sure.
Now we're going to switch and talk about some of the more common bladder conditions that people have, and we talked about this a little bit before the break, but are there some real common concerns that you frequently see when patients come in?
Yeah, I think the common things that we see are when people are starting to have, worsening urinary tract infections or difficulty with urinary incontinence. That's when it tends to be brought up with a urologist.
What are some of the more concerning symptoms that people need to be on the lookout for?
Yeah, anytime you're having a lot of pain or discomfort with urination, if you're having multiple urinary tract infections that seem difficult to treat, or if you just feel like your bladder isn't emptying out the amount of fluid that it should compared to what you're taking in, then those are concerning signs.
Okay, so let's talk about bladder infection. How does someone know they might have a bladder infection?
Yeah, the common symptoms of a bladder infection are typically burning or discomfort with urination, increased urgency or frequency. Sometimes there'll be what we call suprapubic tenderness or tenderness down kind of in the pelvis just above the pubic bone. Occasionally, if it's a severe infection, you'll start to get some fevers or chills sometimes as well.
So another common infection is a urinary tract infection, or UTI. Are those symptoms similar or different from a bladder infection? And what's the difference between the two infections?
Yeah, urinary tract infection is more of a generalized term to cover infections anywhere in the urinary tract, whether it's the bladder or the kidneys. And then a bladder infection is just where it hasn't been able to accelerate up into the kidney and it's just localized in the bladder.
And so
but they're almost synonymous.
Okay, so the symptoms then are the same as what you're saying?
Yes.
And so then how would someone find out whether it's a bladder infection or a urinary tract infection?
Yeah, so generally the way that we evaluate for that is a test called a urinalysis, where we'll actually look at the urine and evaluate if there's bacteria or blood or inflammatory cells, and that helps us determine first if there is an infection and then to what extent it is there.
And if someone doesn't get either a UTI or a bladder infection treated, what are the risks there?
Yeah, the biggest risk is that it can progress and actually ascend up the urinary tract into the kidneys, which is an infection that's commonly called pyelonephritis. And then you can also get to a severe infection to where the bacteria actually gets into the bloodstream, which can make you extremely sick.
Okay, and as far as treatment goes, what is typically the go-to treatment when it comes to a UTI or bladder infection?
Yeah, oral antibiotics are usually the main treatment that we use, and occasionally if we run into a bacteria that's resistant to oral antibiotics, or if we get infections in the bloodstream or the kidney, sometimes we'll use IV antibiotics for that.
Okay, great. So let's switch gears and talk about another common condition, which is urinary incontinence. So first, what is that?
Yeah, urinary incontinence is any time that you have an involuntary or unexpected loss of control of urine. And so generally, as urologists, we try to categorize it in two different categories because the treatments are very different. And so the first category is what we call urge incontinence, where your bladder says it's time to go and doesn't give you enough warning to make it to the bathroom. And the other is what we call stress incontinence, where it's any extra pressure that pushes down on the bladder, overcomes the urinary support mechanism and the urinary sphincter. And so when you cough, laugh, sneeze, you leak urine.
Okay. Do we know what causes urinary incontinence?
Yeah, so it can be a variety of things, and depending on the type of incontinence, but it can be anything from just general weakening of the urinary support muscles, which we see commonly after childbirth, all the way to bladder overactivity, where your bladder just kind of overrules the suppressive signaling from your brain and just starts to squeeze and you have incontinence.
Okay. We talked a little bit before about foods and drinks for overall bladder health. Are there foods or drinks that could maybe make urinary incontinence or an infection worse?
So outside of just causing more irritation, foods don't tend to increase your risk of urinary tract infections or urinary incontinence.
Okay. So how do you treat urinary incontinence? Is there medication for that, or what's typically a treatment option?
Yeah, so we have a lot of different options, and it ranges from daily medication to what we call pelvic floor exercises, where you're trying to strengthen some of those support muscles. We also have more procedural or even surgery options, where we do like Botox injections into the bladder that can slow down some of that urgency and frequency related incontinence. We use what are called urethral slings, which help with incontinence with coughing, laughing, sneezing. We even have what are essentially pacemakers for the bladder, similar to what we put in the heart, but we put it to control the nerves of the bladder to help improve that signaling between the brain and the bladder to help better emptying and reduce the urgency and frequency.
Okay. And if someone needs to see a doctor, when do they know it's time, and who do they see? Do they go right to a urologist? Can you talk about that?
Yeah, I think anytime you feel that your urinary symptoms are impacting your daily activities, your quality of life, that's the time to speak to somebody.
Okay.
A lot of times individuals tend to just put up with urinary symptoms because they think, well, this is just the normal part of aging in life. And really, it doesn't have to be. We have a lot of great options that can improve that. And so, a urologist is certainly an easy place to start. Sometimes it's as easy as going to your primary care physician. And if they feel comfortable managing some of those early symptoms with incontinence or urinary complaints, that's great. If not, they'll pass you on to see a urologist.
Okay, perfect. All right, and we're right up against another break, Dr. Brown. So we're going to pause here, but when we come back, we're going to talk about bladder cancer, especially because it seems to be a little unbalanced in men versus women. So we'll explore that topic right after these messages. Stay with us. Welcome back to Healthy Living for Life. Dr. Brown is still with us to talk to us about our bladder health. And so let's start out and talk first about just maintaining some bladder health. So should a person have routine urologist visits?
So I think unless you're getting active treatment for urinary troubles, you don't necessarily need routine or annual exams with the urologist. But generally speaking, an annual visit with your primary care physician can start to identify some of the early symptoms of urinary complaints and problems. And so definitely doing that is the first part of the process.
Okay. And are there other doctors that help support bladder health, like a gynecologist, for example, or is it typically just a urologist?
Urologists play the primary role. There are some gynecologists who do some urinary incontinence work. And so for the most part, urinary complaints are managed by urologists.
Okay. And someone may start out talking with their primary care doctor, or perhaps they'll come to a urologist. Do you just have any tips? This can be a little bit of an embarrassing topic, or one that a person wouldn't necessarily want to bring up if they didn't have to. What's your advice there for people who are avoiding the topic?
Yeah, I don't think there's anything that you could tell us that we haven't heard before. And so this is what we do on a day-to-day basis. Everything that we talk about is very normal for us. And so there's nothing embarrassing or problematic. And as a physician, and particularly a urologist, my primary goal is to help improve those urinary symptoms and get you back doing the things that you'd like to do. And the first step is being able to identify the exact symptoms and what's going on. And, there's no reason that this should be something that you have to deal with because it's just uncomfortable to talk about. It's very easy. And for the most part, we're able to very naturally go through and discuss these symptoms without any difficulty with people.
Okay, perfect. Thank you for that. All right, we're going to switch gears a little bit and talk about bladder cancer. And bladder cancer tends to be diagnosed more among men, and bladder cancer deaths are higher among men versus women. Do we know or understand why there's such a discrepancy there?
You're exactly right that the numbers are higher in men, and what we also tend to see is that bladder cancer is usually diagnosed much later in women. And so we don't exactly know the mechanisms of why that happens. But what tends to happen in the later diagnosis for women is that a lot of their urinary complaints that would initially trigger a bladder cancer evaluation are thought to be due to other problems like a urinary tract infection. And so they tend to be treated initially for those kind of symptoms. And if they don't resolve, then they get evaluated. And so that can make, the early diagnosis for women sometimes a little bit more difficult.
Okay. So besides gender, and evidently being male is kind of a risk for bladder cancer, are there other risk factors that make people, they're at a higher risk for bladder cancer?
Yeah, the most common thing that we see is a smoking history. So active smokers or even former smokers have a higher than average risk than the general population to develop bladder cancer. And so with smoking, we always kind of talk about the risk of lung cancer, but it's a very common causative factor for bladder cancer as well. Family history plays a strong role. So if you have a family member who's had bladder cancer, that certainly can increase your risk. And then any type of prolonged chemical exposure, so people that work in factories or areas where they're exposed to chemicals for a significant period of time, that can increase your risk as well.
Okay. Does bladder cancer have symptoms?
The most common symptom that we see is visible blood in the urine. And so when that happens, there's pretty strong recommendations from the urology organizations to have a full evaluation for potential bladder cancer. Sometimes you have blood in the urine that isn't showing up to the naked eye, but can show up under the microscope. And so as part of your annual exam with your primary care physician, often you're asked for a urine sample, and that's part of that screening process.
Okay. And so they're testing for bladder cancer when they're taking that urinary sample. What are they looking for, or how is that diagnosed?
Yeah, so the urine sample can tell us if there's blood in the urine and how much blood is there. And depending on the quantity that's there, it can raise some red flags that would prompt an evaluation. If there's a high enough suspicion for bladder cancer, often we can actually look under a microscope at that urine sample and look for any cancer cells in the urine itself as well.
Okay, are there different types of bladder cancer?
There are. The most common type that we see is called urothelial cell carcinoma, but there are other variations such as papillary or squamous cell carcinoma of the bladder as well.
Okay. And are treatments for bladder cancer similar to other types of cancer, or what are typically treatment options?
Yeah, so treatment for bladder cancer really depends on the depth of invasion. So bladder cancer tends to start superficially on the lining of the bladder, and then the more time that passes, the deeper it invades into that bladder wall. If it's superficial, we can go in and actually scrape that tumor out of the bladder, and that oftentimes is all the treatment that's needed. If it's a more aggressive cancer or it progresses deeper into that bladder wall, sometimes we'll prescribe different medications that we instill into the bladder through a catheter that help fight off a recurrence of bladder cancer. And then if it gets deep enough to where it's actually in the muscle layer of the bladder, we'll often do surgery to remove part or the entire bladder itself.
Wow, okay. Well, we're almost out of time here, Dr. Brown. Any closing thoughts or something you want to make sure we hear today about bladder health?
Yeah, I think the biggest takeaway is just if you're starting to notice changes in your urinary symptoms and you feel like something isn't how it should be, don't be alarmed or concerned to talk to a physician about it. We're looking for ways to identify people with these problems and have a lot of great options to help.
Okay, great. Thank you very much, Dr. Brown. We appreciate your time and all your information.
Absolutely, no problem.
And thank you so much for watching this morning. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, and we'll see you next weekend.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.